Assalamualaikum warahmatullahi wabarakatuh. My name is Nadiatul Syima binti Muhammad Shahid and I'm from University Technology Mara, Bertan campus. This research was conducted with my colleague and today I would like to present my research title on knowledge, attitude and practices towards tuberculosis disease among health sciences undergraduate students across sectional study. Introduction. How can tuberculosis disease have a global impact? Despite being preventable and curable, tuberculosis continues to be a primary cause of illness and mortality across the world. In 2020, according to the World Health Organization, WHO, mentioned that the incidence of tuberculosis reached 10 million people annually with around 2 million deaths and 7 million new cases. As we know, people who are infected with TB infection may not show any symptoms of illness and they possible to transmit the disease easily. TB is caused by the airborne Mycobacterium tuberculosis that can be transmitted from person to person. Furthermore, as you can see from the map of Southeast Asia, we are surrounded by countries such as Bangladesh, Indonesia, Myanmar and Thailand, which are included in the list of C nations with a high TB burden. How TB cases in Malaysia spread? So most of the increase in TB cases in Malaysia is due to the high number of people who have the human immunodeficiency virus. In other words, we call HIV. So some of these people do not take precautions when meeting new people, and some of them feel comfortable with their health status, and some of the TB carrier do not care about their illness and they still traveling abroad. In Malaysia, TB was frequently characterized by its symptoms, such as dry cough or getting thinner because of its symptom. And this symptom due to a persistent cough or coughing up blood. And Malaysia has set up its first national TB control program since 1961 in order to prevent and control our TB cases. However, even though a number of control measures have been put in place, TB cases are still increasing. Therefore, undergraduate students in health sciences are at a high risk of getting tuberculosis disease because they are dealing with patients and exposed when they are in the same building. For example, nursing students may come into contact with patients who are suffering from tuberculosis disease. At the same time, environmental health students must learn how to investigate TB cases and inspect patient house. So the risk of tuberculosis infection among health sciences students is high and still unknown in Malaysia. In addition, there are studies also show that the local population of Mycobacterium tuberculosis is becoming less sensitive to antibiotic and more resistant to drug. Knowledge, attitude, practice towards tuberculosis disease. In this slide, we can see that the recurrence of tuberculosis disease began almost 2 decades ago. So there has been increasing concern about education and the competence of healthcare providers to deal with specialized issues of tuberculosis knowledge, practice, prevention, and treatment. So there are several studies which report that knowledge and attitudes of medical students towards tuberculosis are still inadequate and need improvement. Most studies focus on clinical research associated with human and also bacteria itself. However, TB issues are highly impacted by knowledge and behavior, which require community engagement in TB preventive efforts. According to Jamaluddin et al. 2019, stated that the level of knowledge and awareness regarding tuberculosis disease among undergraduate students is relatively low. Therefore, the objective of this study is to assess the knowledge, attitude, and practices towards tuberculosis disease among health sciences undergraduate students. Methodology. This study is a cross-sectional survey conducted in Faculty of Health Sciences, University Technology Mara at campus Batam, Malaysia. Our respondents are students who enroll in 6 programs, which were environmental health, medical laboratory technology, nursing, physiotherapy, occupational therapy, and finally, pharmacy. So the campus was selected because it had 6 health sciences programs that mostly need to have practical in private or government hospital or district health office. For the questionnaire design and data collection, the survey consists of 4 sections, including socio-demographic information, tuberculosis knowledge, attitudes, and also practices. And all questions were digitized to allow distribution online. Result and discussion for demographic characteristics. Most respondents were female and Malay between 18 to 20 years old. The program profile revealed that most respondents were students from environmental health. According to the previous research by Akin et al. 2011, indicates that the level of health sciences students, particularly nursing students, is higher than other students from other disciplines. Generally, environmental health students have learned in one of their courses, such as environmental health, communicable disease control, the source of tuberculosis disease, how it may be transmitted, how to investigate and control tuberculosis cases and outbreaks. However, it is obvious that other medical programs such as physiotherapy, occupational therapy, and medical laboratory technologies still require caution since they may encounter patients infected with tuberculosis disease. For example, Selangor has the greatest number of TB cases in Malaysia, and the majority of students who participated in this study presently stay there. Let's discuss about tuberculosis knowledge. The overall knowledge of undergraduate students in health sciences on tuberculosis was found to be good. The majority of health sciences undergraduates correctly recognize the source of transmission by a microorganisms. Furthermore, it shows that they have good knowledge about symptoms of tuberculosis and understand that this disease is curable. It suggests that more than half of the students may have received tuberculosis knowledge through lectures during their programs. In this slide, the overall attitude of the respondents towards tuberculosis disease is moderate. As we know, tuberculosis has long been recognized as an occupational risk for healthcare workers. So therefore, caring for patients with tuberculosis might cause anxiety among health professionals, especially among students in the health professions, due to their lack of knowledge or the stigma surrounding tuberculosis patients. And because of this, the level of concerns about caring for patients with tuberculosis might cause students to develop negative attitudes, and thus the quality of care or investigations towards tuberculosis case might be negatively affected. For example, in this study, our question for touching tuberculosis patient staff, a lot of them answer yes, they try not to touch it, and this statement proved that they did not know that tuberculosis cannot be spread if you touch things. For practices, the respondents in this study were found to have moderate tuberculosis disease practices. Based on the survey, most students understand that active smoking will increase the risk of tuberculosis disease. However, only 24.1% of the students in our study agreed to do the tuberculosis medical checkup once a year. In this research, most of the respondents show satisfactory practice with BCG immunization, practice a proper cough and sneeze ethics, and they are willing to go to any healthcare facilities if they have a prolonged cough or experience tuberculosis symptoms. While attitude is not necessarily translated into knowledge and practices, but attitude is a crucial factor in tuberculosis disease handling since it may affect knowledge and practice. In fact, students with knowledge are more likely to convert knowledge into practice if they have a good attitude and practice. The current study concludes that the level of tuberculosis disease knowledge, attitude, and practices of health sciences undergraduate students in Penang was moderate. To reduce the risk transmission of tuberculosis, knowledge of health sciences undergraduate students needs to be improved as well as attitude and practices by enhancing educational programs for university students. Thank you.